Some people may be asking the questions, why would so many doctors be recommending the COVID vaccine if it's not safe and effective? And at the same time, we have a couple hundred doctors at least bringing forward evidence and information about the vaccine not being safe and about it not being effective. So what's going on? Why would so many doctors still recommend it? Well, let me offer this possible explanation. So doctors, when they're going into medical school, there's a lot of time, a lot of effort, a lot of energy, a lot of family support, money, a lot that's needed to get accepted into medical school and then to make it through medical school and then to get through residency. And there are just so many steps involved in this process that take a lot to get through, that once someone has accomplished all of those things and has gotten their license to practice medicine and they're a doctor, they really want to protect that. They want to protect what they've worked so hard for. They want to protect their reputation. They want to protect their patients. So one of the things that they can do in order to make sure they're staying in a safe zone and have kind of like an umbrella of protection over them is to work under the guidelines of the professional organization or the public health agencies that apply to them. So like if a doctor's an OBGYN, the American College of Obstetrics and Gynecology is their professional organization. Or if somebody's a pediatrician, the American Academy of Pediatrics is their professional associations. Whatever your specialty is, you usually have a professional organization that sets forward guidelines to practice under. And then there's also the public health agencies that will also do the same thing. So doctors will kind of want to stay and under those guidelines and use those guidelines to kind of keep themselves protected against not only do they have to worry about paying back their student loans once they finish college, they of course have to, like everybody else, make enough money to feed their families and pay their bills, pay back their student loans, but they also want to avoid any lawsuits, medical malpractice, any kind of liability. So it's kind of like saying, well, it wasn't my idea. I was doing what the guidelines said. I followed the guidelines. So it's kind of like I guess you could say, like in a court of law, you're falling back on, I was following the guidelines of the CDC or, whoever the organization is that's putting forward the guidelines. So there's that. And then there's also the other purpose that following the guidelines helps doctors, because let's say a doctor gets a patient that comes with them that they have a disease that wasn't around when they were back in medical school, or it's just a newly emerging disease and they're wanting to know what's the best way that I can help this person. They go to the guidelines of the professional organization of the public health agency and they look, oh, this is what we do. This is what I'll do for this patient. So it's supposed to be able to not only protect doctors and keep them safe, but also help them to be able to treat patients in the best way possible. So let me just tell you a little story about guidelines. So there was a doctor, he was an OBGYN, and he had a patient, and she was pregnant. She had taken the abortion pill, and then she changed her mind. She realized, I don't actually want to have an abortion, I do want to have my baby. And she called up the doctor and said, I need your help. I don't want to do this. Help me save my baby. She was obviously upset and asking for this doctor's help. And he's like, I don't know what to do with this. We shook the abortion pill. Now she wants to reverse it. This isn't even, I don't know. So he says, all right, let me go to the guidelines. Let me go to my professional association and public health agencies and see what to do. Nothing. There is nothing. So he says, this is the part where, okay, we follow guidelines. And then there's also what's usually called practicing medicine, where the doctor would then rely on his bank of knowledge and his skill and his experience and kind of weave those things together using his own intellect and reasoning and skills that he's learned to then do something to help the patient. So what this guy did was he said, and this is really, really simplified, but basically if somebody was about to have a miscarriage or having a miscarriage, they could try to save the pregnancy by giving them some progesterone. So this is what the doctor said, well, and it's not a spontaneous abortion. She was doing an elective abortion, but let's apply the same principle and see if we can help her. It's better than nothing, right? So they do it. It actually works. The pregnancy continues. She gives birth to the baby. The baby's fine. I think the baby's about 14 years old now. So the doctor realizes, like, hey, was this just a coincidence? So let's check it out. So he's treating a lot of patients. He's talking with this other doctors. And this is normally like the process that would happen is that doctors would talk to each other and say, hey, I had this case, I had this patient that had this is what we treated with, and this was the outcome, and they'll share that information. So they kind of will have these case studies that they will like sort of talk about and collaborate about, and then they'll do some research from there. They'll start doing some actual publishing research papers to share with others, and they're building up a body of medical knowledge in this way. And many times what will happen is the governing agencies, the professional organizations, public health agencies will then take that information and develop guidelines so that now everybody will know. Now you might think this is the part where I say, well, yes, the American College of Obstetrics and Gynecology looked at the research paper put forward by this group of doctors that did this study on several hundred women and their babies, and they found that it's not 100% effective to reverse the abortion, but it's actually 68% effective. And you know what, if you're that mom that's saying, help me save my baby, that's, you know, not the best number to you, but it's better than nothing. It's better than just saying, go home, I can't do anything. But that's actually not what happened. The American College of Obstetrics and Gynecology didn't adopt that as the guidelines. What actually happened was they said, no, you can't do it. It's not safe. It's not effective. It doesn't work. It's harmful to patients, and they didn't adopt it to a guideline. So even now, if a woman were to try to go and get help about reversing abortions, a lot of doctors will kind of look at her like she has 5 heads because there's no guidelines for it. So, matter of fact, just as a side note, if someone does want more information about or need that actual service, there's an 800 number that has a network of doctors that will do the protocol that was researched. And then personally, I've actually worked with these women. Their pregnancies are just like everybody else's pregnancy. Their babies come out great, just like anybody else's babies, 68% of the time. So it does work. I've seen it work. I've personally seen this process work. However, it's not the guideline. So my point of telling you this is that sometimes the guidelines are not perfect. They're just not. Sometimes there's research that hasn't been looked at yet, or they're still in the process of developing guidelines and doing the research and kind of building up that body of knowledge to get to the point where guidelines is developed. Right now, the CDC for the COVID vaccine, they've come out and said it's safe and effective. Completely bizarre because the research wasn't even over in order for them to get that conclusion. It's like going to a boxing match and they come out and tell you who won and the fight's not even over yet. So the fact that they did that is odd. Now, some people will say, going back to the example about the abortion pill reversal, some people will say that the reason it's not a guideline is because the abortion pill is obviously a drug from drug companies, and drug companies will donate to certain politicians and organizations and make sure that they get their agendas passed, and that, you know, if we were promoting that it's reversible, it's not good for that drug company. So some people feel like that guideline never came to fruition because it goes against the people who benefit off of the abortion pill, the drug company and politicians. So that's always a possibility, right? These guidelines, they're not infallible. They're not, you know, some word that comes down divinely inspired. They can be wrong. They could be just wrong. They could be outdated. They could need to be updated. Or it's possible that the person or the entities making those guidelines are falling for some kind of corruption, are compromised in some way, or corrupt in some way, or they have not as their motive the health of the public, but they have as their motive financial gain for themselves or for their organization, or some kind of political gain, whatever it is, that they're not putting the health of the public as the number one priority, and therefore the guideline is really helpful, but they have some other agenda. They have some other motive that they're putting as number one, and therefore the guideline doesn't seem to make any sense or just isn't good for the health of the public. So I'm not saying I know that's what's happening right now with the coronavirus vaccine, but I am saying is that a lot of doctors, they follow the guidelines because that's what they normally do. That's what normally goes on in the medical field. Doctors follow the guidelines, and many of them are just following the guidelines that are set forward by the CDC. And you can't blame them. I mean, if a doctor has to see 4 patients every hour for 8 hours a day, they're really, really busy. They don't have time to sit and do all this research and figure things out. They're trusting that the public health agencies know what they're talking about and giving us good information. But we can clearly see that that is not what's happening here, with 5,000 deaths and several hundred serious adverse events that are from the COVID vaccine. It needs to be looked at. Why we're still saying it's safe and effective is just beyond me, but just wanted to address that issue of the confusion people are experiencing because they're like, well, my doctor told me to get it. Why would my doctor tell me to get something that's not safe and effective? He's probably following the guidelines, but we may have a problem here with the guideline. And this is why it's such a key that every person can make their own medical choice. Every person is supposed to be able to make their decision about what they want to do with their health care. You have to consent to it. You have to say, yes, I want to do it. You have the right to refuse it. Just because your doctor recommends something doesn't mean you're required to do it. And that's another kind of red flag for us right now with these mandates and these requirements. That's not normal. That's not natural. That is never a person should be forced to do something for their health. That's your body, that's your health that you have to live with for the rest of your life. No one else should be making that decision but you. So just wanted to share that with you. I hope that helps in these kind of confusing times.